Hi, Professor. This is Troy. I'm going to do a quick postpartum assessment as you requested. So we're going to do the bubble heat. I don't have an actual patient, so I'm just going to improvise that someone is here. All right, so hi, good afternoon. My name is Nurse Simmons. I'm here to do a postpartum assessment on you. Okay, so we're going to start with the breast. The breast is over here. And what I'm doing for the breast, I'm feeling the breast. I'm feeling for any bumps, any mastitis, any engorgement. I'm looking at the nipples to see if it's inverted, if it is also dry. If it is dry, we're gonna add some milk, some of the milk to get that dryness off. But I'm just looking and I'm feeling the breast, both sides, to see if if there's any engorgement, any mastitis, any lumps. All right. I'm gonna ask her if she is okay with breastfeeding, if she plans on breastfeeding, and so on. So we're gonna go to the U, which is the uterus, right? I'm looking at the uterus. I'm looking to see. I'm touching it. I'm holding at the bottom like this, so it doesn't get inverted or shifted. I'm gonna ask her I'm gonna rub it to see if it's firm or boggy. We're hoping that it's firm. If it is boggy, we're gonna massage it. I'm gonna also take her hand and tell her to massage it. All right. And then I'm also at the same time we're checking her lochia to see when we massage it if she's bleeding. We're gonna check to see if it's alba, rubia, or serosa. We'll move on to the bladder. I'm gonna ask her, did you urinate? Did you void it since you gave birth? Which is important. If she didn't, we're gonna be able to. The doctor's gonna prescribe something for her. I'm gonna encourage her to ambulate, to walk around. I'm gonna probably try to run some water so she can be able to get the sensation of urinating, which is very important. And we're gonna move on to we did the bladder, we did BUBBL. We're gonna look at the lochia, right? Did I miss something? I don't think I missed something. Lochia, we're checking to see the color, if there's any odor, to see how much. If it's saturated, ask her how fast it's being saturated. We're gonna check underneath her to see if she's pooling at the bottom, which is important. I'm gonna check also the area of if she had a episiotomy. I'm gonna check to see the laceration, the level, if she's healing. We can try the sitz bath. The doctor could give her a spray, thermoblast, I think it's called, just to kind of get that feeling and to get the healing back. And I'm gonna document how many milliliters she has with the blood in the lochia. All right. So at the same time, I check the episiotomy. I check, as I said, the laceration, the level, and I'm gonna let her know if she's in any pain. I'll give her some analgesic. So we move on to the Holmes sign maneuver. I'm gonna dorsiflex. I'm gonna dorsiflex her leg, and at the same time, I'm looking at her calf muscle. And also I'm touching it, palpating it to see if it's any redness, tenderness, if she's in any pain. Also, I'm doing it on both sides bilaterally. If she is in any pain, right, I'm gonna document that. I'm also gonna let the doctor know. It could be signs of could be a DVT, a deep vein thrombosis, and that could lead to a pulmonary embolism if we don't correct it as soon as possible. Then I'm gonna go on to the evaluation. Hey, did you name the baby? How are you feeling about the baby? Are you breastfeeding? How are you feeling about about how the pregnancy was? just to get a psychological evaluation, how things are gonna be at home with the baby, and if she's happy. I hope that was good enough. Try to make it as fast as possible because of the time and to upload it. But there's a little other things I didn't mention, but I hope that you enjoyed it.